Hi, Dr. Regan Robertson, CCO of Productive Dentist Academy here, and I have a question for you. Are you finding it hard to get your team aligned to your vision, but you know you deserve growth just like everybody else? That's why we've created the PDA Productivity Workshop. For nearly 20 years, PDA workshops have helped dentists just like you align their teams, get control of scheduling, and create productive practices that they love walking into every day. Just imagine how you will feel when you know your schedule is productive, your systems are humming, and your team is aligned to your vision. It's simple, but it's not necessarily easy. We can help. Visit productivedentist.com/workshop. That's productivedentist.com/workshop to secure your seats now.
For me, I always like speakers that can really inspire and excite you and show you what's on the cutting edge, show you what's new.
Sure.
And so, me not being a dentist and having that clinical background, it might be a yawn fest to you, but for me, I was on the edge of my seat. I was just like, this is the coolest stuff ever.
Welcome to the Everyday Practices Podcast. I'm Regan Robertson, and my co-host, Dr. Chad Johnson, and I are on a mission to share the stories of everyday dentists who generate extraordinary results using practical, proven methods you can take right into your own dental practice. If you're ready to elevate patient care and produce results that are anything but ordinary, buckle up and listen in.
Hey, everybody. This is Dr. Chad Johnson, and welcome to Everyday Practices Dental Podcast with my co-host, Regan Robertson. Regan, how are you today?
I'm feeling rested. Chad, how are you?
Excellent. Well, rested because you just got back from Houston, right?
I did. I just went to the second annual Airway Summit that Dr. Meghna Dassani put on.
Yes. So Meghna is a PDA grad and probably a Grand Slammer too, I imagine.
And she's on PDA faculty now too.
I don't think I knew that. So good. So for our listeners, if that's new information to me, it's got to be new information to some. She's based out of Houston, and she had this Airway Summit. Did she run this, or was she the main speaker there? How did that work? I don't know much about it, so I'm going to pretend like I'm just a regular listener on this show, that's listening to it, and ask you the questions so you can fill us in about this. Is this an annual thing?
It's annual, and the answer is both. She was the lead presenter, and she facilitated the entire event. So she coordinated, organized, owned it from start to finish, and it was a phenomenal event with some incredible speakers, and she did a really great job at sharing her knowledge with her group of experts. So if you've heard me on this podcast before, I've talked about my own health team as like a support group around me. That's exactly what she did. She brought in medical doctors, laser experts, fellow dentists. Myself, I spoke on authentic marketing as well. So I was on day one, and she basically said, here is the support team that I've used to get Airway up and running and off the ground in my practice. And, you can learn from all of these experts to figure out how to implement it in your practice as well.
Okay. Was this a 2-day conference? 3?
It was a day and a half. She had it at the Houston Space Center, by the way, which was so incredibly cool. And they had an astronaut suit right next to us on stage when we were presenting. So I liked the metaphor for it, because I feel that the group, I think when dentists go out of their way to learn an additional modality, to bring in a special service mix, that takes gumption. That takes something beyond the status quo. That should be recognized. And I was really, really passionate to see there were a lot of doctors in the room. And I was I was empowered to see how passionate everyone was about what's going on with Airway right now. I looked up some statistics, and I saw that according to the NIH, 80% of adults that have some sort of sleep disordered breathing remain undiagnosed today. And I don't know if it was the NIH, so don't quote me on this fully, but I remember another report that I was,
sorry.
I know, there was another report, I'll say estimated. There was another report that was estimating that children who suffer from sleep disordered breathing are up to 90% undiagnosed. And I think that this is gross. Like,
Yes.
I think this is very unfair. So I was really, really excited to see everyone coming together. And I understand the difficulty of just having the medical, dental, bodywork community come together in order to make that diagnosis. And because dentists can't diagnose, I've heard, but they can screen for it and they can treat for it. So you have to work together. It's like your hero's journey. You have to be guides to each other and support each other. And that's a lot of effort. It's a lot of time. It's a lot of dedication. And so I was honored to be there to see people caring that much about humans.
Yes. Give me some logistics here. Day and a half. Was this over like 30 dentists? Was it mostly dentists only? Was, like
dentists and some hygienists.
Oh, good.
Mm-hmm.
Very cool. Was this like breakout sessions, or was it all in the same room, multiple speakers, or the same speaker the whole time? Did Meghna speak the whole time, or how did that work?
It was all in one room, and it was multiple speakers. Meghna kicked off the day and sort of set the tone for the philosophy. And then she had a fellow dentist who has brought in frenectomy treatments, and she spoke. There was, like I said, a laser expert from Deca Lasers was there and talked about the really, really cool stuff that's going on with lasers. And I was mind blown. It was phenomenal. So he talked about some of the crazy treatment that was going on in your throat, so that lasers can support. We had a medical doctor, an ENT was there as well. She had members of her own team discussing medical billing and the intricacies of medical billing. It was overall really, I think it was well-rounded.
Something I found out was that Deca Laser is based out of Florence, Italy.
They are. And they had pictures of their Italian showroom floor and some cases. I nerded out, Chad, like you would not believe. They had video, like the ENT had video. There was different examples. It was, lasers are cool, man.
Lasers are cool. And I've noticed that they offer lipo kind of lasers too, which is a side, thing, not for dentists to try except on themselves for
entertainment purposes
reasons. Yeah. But Deca does it's a CO2 based laser that I know of traditionally. I don't know if they make other kinds of lasers too. Do you know?
I can't, I should know that. In fact, I would fail the test because it was Dr. Scott Parker that was presenting. And so he did talk about the wavelengths of the lasers and the CO2 versus the other lasers.
Right.
I don't recall. I did hear about how much Deca invests in research and development, and then what laser wavelength could be used for which application. It was just so informative. I mean, I've been around a lot of lasers. So I'm fairly, like on a layman's level, at least, I'm informed on what the potential is for lasers, but I had not thought about fractional use in the throat before. And that was, again, of course, it's tissue though. So that made sense to me. But it was just, for me, I always like speakers that can really inspire and excite you and show you what's on the cutting edge, show you what's new.
Sure.
And so, me not being a dentist and having that clinical background, it might be a yawn fest to you, but for me, I was on the edge of my seat. I was just like, this is the coolest stuff ever.
Yeah. I started checking into that kind of stuff about 11 years ago, but I hadn't done much with it just because it was out of budget so far as the quick answer, someone could be like, well, it's actually in your budget. I could make it work monthly. And all right. But I'm just saying, at the time, and even still, I'm just like, I've got other, bills to pay. When I've got fun money, then I'll certainly invest more into this.
He did have me. I was ready to drop $120,000 that I don't have. I was ready to just like drop it on an ablative laser. I was like, can I just have this for my own? Because he was showing faces, before and after. They had like this older woman, I think she was like in her 80s maybe. And it took, though, the way that they had to ablate her, it was like 6 months of healing. So it was intense.
Wow.
Yeah, I'm used to like hearing about 6 weeks is like the max, but it was a completely new face. So I was like raising my hand. I was like, sign me up. Let's go. And I knew you would be too. I'd be like, Chad, come on, get one.
Right. Huh. So overall, did they talk about like the nitty gritty of CPAP versus
Yes.
versus oral appliances.
Yes, there are over 350 oral appliances, I found out. And Meghna went into details on many of them, and she shared her perspective on the different appliances. And yeah, CPAP was discussed. A lot of my I would highly recommend getting Meghna's book, The Tired Child. I know you can find it on Amazon. I've read
That
it
was
twice
just
now.
released this spring, right?
It was just released this spring, and it is the best. It's just, well, from a marketing perspective, for me, it's the best because any parent can read it and understand what it is that she's saying. But she does go into the science of sleep and what happens at your N1, N2, N3, N4 stages of sleep, and then goes beyond what we're used to. I'm used to the surface of you go into REM sleep or you have deep sleep, and that's kind of where my discussion ends. She talks about how the brain sorts and files information at this stage of sleep. So it is like locking in memories from the day and then flushing out other memories. And then when you're dreaming, how it's helping you process emotions and things from the day that you weren't comfortable processing during the conscious waking hours. And she ties that together really beautifully, I think. And the one big takeaway that I thought that I really, really liked is she said, which is the number one question she gets is, which is the best appliance to use?
Yeah. I've heard.
And her answer is the appliance that the patient will use.
Mm-hmm.
So she went down into her experience with it. If you have bruxism, is that clenching or is that grinding? Bruxism.
It's a general term that would apply like a dynamic movement. Clenching to me wouldn't be bruxism.
Yeah.
It would be
right.
The grinding.
So there were so many aha moments. I used to have a night guard years ago and I could never keep it in ever. I just kicked it out all the time and it was expensive too. And so I just gave up on it and didn't use it. And she was explaining that upper appliances can be difficult for people who grind at night. And she's like, they'll kick them out. They won't use them. And I had an audible gasp and I was like, what? And so she laughed, because I'm in the back of the room. And anyway, she was like, sounds like Regan has experience with that. And then another time, some of the symptoms were surprising to me as well, that shouldn't be overlooked, that people just overlook. And so she said, if you ever drool on your pillow, and I again audibly gasped, and she was like, do we have a drooler, Regan? I was like, well, sometimes I wake up and I have drooled, not all the time, but sometimes. And it made me highly curious. Her presentation made me curious and wanting to know more. And of course, my particular presentation
what about it?
On marketing.
I didn't know.
What about what?
The drool.
Is it because am I mouth breathing? Is it a sign of a sleep disturbance? If that is one of the symptoms, do I have other symptoms to it? My my kids have told me at times that they've heard me snore off and on, like if maybe I'm taking a nap or something. And so it made me more aware of the importance of getting the full night's sleep. And as an adult, I definitely will cheat on sleep, or over the years, if I've had anxiety or work trouble, something that I'm stressing about, I will lose sleep over that. And I'm understanding now, if you can't flush everything out at night and build up your immune system by going through all the proper levels of sleep, you're robbing yourself and you're kind of setting up this snowball effect. And so, like I said, plugging this in to the marketing aspect of it, we must grow awareness for people so that they can connect at their level of understanding, which means symptoms-based. Let's focus on the symptoms. And then solution-based, people think it's just the CPAP, like that is your only option. And that is not the truth. There are lots of other options for you to try. And people are not aware of that. And I actually had 2 Uber drivers who, before the workshop, that were in different sleep apnea journeys. So I ended up talking to both of them about it. And I just realized there is such a pressing need to create educational marketing and grow awareness around this topic, because dentistry is, as the general public knows it, can do, it's limited. There's so much more that we can actually do to help people.
Yep. But we see patients a lot. And what I mean is, I don't know how the best way to word this, but within the community, we're seeing patients more often at times than their primary physician. So, so we can have better community footprint or hand touching, like a community touch that goes beyond fixing a CPAP cavity,
Thank you. It can go deeper, and it can go deeper than addressing the symptoms alone. So Meghna and the entire team of speakers, I heard all of them from their area of expertise, including myself. I think we all had it represented in one way or another. We have to go underneath the surface. We have to ask why something is occurring, and then we have to go underneath that as well. So they really practice what I call the third level of why. It was developed from Skip Miller. And I just really appreciated that. To me, that is being the patient's advocate. When you're willing to go a level down, when you're willing to take the time to screen and ask those questions. Yes, you are right on, Chad.
So just for reference, if people are listening to this in years to come or whatever, referencing back, this is 2023. It's September. So this is, possibly going to be an annual thing that is in September, yes. Though I imagine they have the right to move it accordingly. So, but currently it's, first week of September kind of thing. It's in Houston, at least this last year. And what was the official name of the conference?
Yes, the official title of it is Airway is Life Sleep Summit, and she will be having one next year. She already has doctors signed up for it for next year.
Do you have the date on the website?
So I think that the date, no, there's no 2024 date up yet. And okay. I can see if I can get, a website or something at time of publication for this. But we have some exciting things in the works, and it will be in September for sure. And if she has a link for it, we'll include it in the show notes.
It's fantastic. Well, Regan, thanks for filling me in, and the listeners, more information about this. And the nice thing about Houston, the East Coasters, the West Coasters, the Midwesterners, we all can hit Houston pretty easy. That's the beauty of Texas. So
I would like to extend my gratitude to the healthcare community that is considering and taking steps and putting in advanced treatments like this, because I can see now from a 360-degree viewpoint, the amount of dedication it takes to put something like this in, but how much healthier it's making our communities. And my big takeaway from this, from all of the doctors there and the hygienists and the team, was they clearly want to grow awareness. They want to be able to treat more patients so that they can reshape their communities. And I just think it's a beautiful mission, and I was really honored to be part of it.
That's right. Very cool. Well, listeners, can't wait to connect with you again next week for our next episode. And thanks for joining us today to talk a little about sleep. Thanks, Regan.
Thank you, Chad.
Thank you for listening to another episode of Everyday Practices Podcast. Chad and I are here every week thanks to our community of listeners just like you, and we'd love your help. It would mean the world if you can help spread the word by sharing this episode with a fellow dentist and leave us a review on iTunes or Spotify. Do you have an extraordinary story you'd like to share, or feedback on how we can make this podcast even more awesome? Drop us an email at podcast@productivedentist.com. And don't forget to check out our other podcasts from Productive Dentist Academy at productivedentist.com/podcasts. See you next week.